Hello and welcome to our podcast. Today I'm Stuart Gandolf here, and today I'm joined by Justin Gardner, who is founder and CMO of Active Skin Repair. And today we're going to talk about how to launch a successful healthcare consumer product in a saturated market. So, first of all, welcome, Justin.
Thank you, Stuart.
So good to speak with you again. So, Justin, when we talked, when we set this up a few weeks ago, I was really intrigued by the story of how you've built your company, how you're continuing to build it. There's a lot to talk about here, but I guess first of all, tell us a little about your background and then, how you came to found and now be the Chief Marketing Officer for Active Skin Repair.
Sure. So my background has always been in healthcare marketing. So started with in a big company with Johnson, and then moved over to a startup biotech med device company that used had a regenerative technology for diabetic foot ulcers and venous stasis ulcers, and helped market that for about 6, 7 years. And then after that, I decided to go start my own marketing agency, primarily in helping more startup companies launch products into the hospital space. And because of my previous experience in regenerative medicine and wound care, a lot of our clients came from that space. And that's while I was running that agency, I discovered a technology called hyperchlorous acid, where I helped a client launch that into the hospital space. And that's the technology behind active skin repair. So, long story short, I decided to sell my agency, license the hyperchlorous acid formulation from that medical device company, and brought that to market. Instead of launching it into the hospital space, though, we used the OTC 510(k) approval from the FDA, and launched it direct to consumer.
That's great. So, for the people that aren't familiar with hypochlorous acid, tell me about what your product is for. Expand a little bit on what active skin repair is for the consumer market. What does it work? How do you position it? We're going to talk more in detail, but just what is it?
Sure. So hyperchlorous acid is the same molecule your white blood cells will produce. So if you get cut, scrape, burn, any type of skin damage, your body's immune response is to send white blood cells to that injury, and inside the white blood cells is the molecule called hyperchlorous acid. And it does three primary things. It's a really powerful antimicrobial, so it kills 99.9% of bacteria, viruses, and fungi within 15 seconds. It kills really complex bacteria like MRSA and C. diff, so some really hard to kill bacteria. It also helps reduce the inflammation from that injury, and it speeds up the natural healing process. So you really have this non-toxic, powerful antimicrobial. Because it's innate to your immune system too, there's no allergic reactions to it. So it can replace things like really toxic antiseptics, topical synthetic antibiotics, things like that.
So it's funny when I grew up long time ago, there used to be, I remember it was hydrogen peroxide and something called merthiolate, which I don't think they even make anymore. So, and it's come a long way since then. Um, it's funny how necessary this product is. It's funny. I scratched myself a couple weeks ago, and all of a sudden, like I had an infection. Like, what the heck? It's like, gosh, that's stinks. So I have to remember to make sure I go buy some of your off your card over there. It sounds like an exciting product. And I've heard of hypochlorous acid before with other clients, but not in a consumer setting. Is there, are there other products out there using hypochlorous acid on a B2B or B2C product? Is that growing? Like what's happening there?
It's growing like crazy, actually. And the molecule's been around, for hundreds of years, right? I mean, it's innate to our immune system. So, but scientists had figured out how to replicate the molecule back in the 1800s, where we had the real technology advancement came about 15, 20 years ago when we were able to figure out how to stabilize it, get it into a very controlled pH level so you can keep the pH between a 5 and a 7 and keep that antimicrobial efficacy for up to 2 years in a bottle. So that really changed how the molecule could be used. It didn't have to be made bedside. You're able to stabilize it and get it into a bottle. we were one of the first real OTC brands to launch hypochlorous acid. It was primarily thought of to be was being used in surgical procedures and chronic wounds, a lot in outpatient wound care centers for the like diabetic ulcers and venous stasis ulcers, but not really much on the over-the-counter side. So we had the ability to really introduce it to the consumer. Now, there's probably 30 plus brands marketing hypochlorous acid. It really caught on around COVID time, specifically on TikTok as a facial spray to combat acne. And so funny enough, that's where it really came to life. And there's some bigger brands now that market that facial spray side. But what makes us different is we do have the 510(k) clearance from the FDA to be used on open skin. So where you're watching most of the hypochlorous acid, and 95% of them are just cosmetic. So we're a little bit different where we have approval to be used in open skin. But lot more on the market today.
Yeah, and so we talked also about Neosporin, which is funny. Um, again, just having gone through, I think when I met you, I'd just gotten through getting some stitches after going out trail running and running down the side and scratched myself pretty heavily, or cut myself rather. And I was surprised at Neosporin. The urgent care people said, "Oh, you shouldn't have used that." So that it's not perfect. There's some challenges with that brand. What are some of the challenges in competing with it and differentiating yourself? Because people know that brand, right? That's become a leader, market leader.
I mean, it's a household brand. I think it was invented in the 1950s. So it's been around for 70 plus years. It's what our parents used on us. And it has that Johnson and Johnson association too, which I think a lot of people take that association to be a trusted kind of household product. Now, Neosporin itself, though, has a lot of problems in that it has a really high rate of allergic reaction. I think it's something around 15 to 20% of people will have an allergic reaction to one of the synthetic antibiotics that they use in that. And that's why most clinicians really don't, because of that high rate of allergic reaction, most clinicians do not recommend Neosporin anymore. The other problem is it's a petroleum based, so there's a lot of if you're trying to keep cleaner products on your skin, inside your skin, petroleum is not just a great base to be using. And then it's synthetic antibiotics as well. So you've got all the issues related to synthetic antibiotic use.
Given the changes, then, how do you position your product differently in the marketplace? And then, from Neosporin, I guess that's the first question. And the second sort of question along with that is, and who is your target audience? Does that vary based on the positioning?
So great question. Uh, I'll start with who our target audience is. And we started when I first launched the company, it was a bootstrap kind of startup, and we knew we couldn't go into mass retail. We just didn't have the capital to go compete with Neosporin or any of the other big pharmaceutical companies in big box retail, CVS, Walgreens of the world. So we decided to go into specialty retail where we felt like we could have more of a brand experience for that customer and be able to educate the store employees on our product who could really kind of speak to the uniqueness of it. So we went into a lot of outdoor sports, surf stores, bike stores, climbing gyms and climbing equipment stores. And we really built a cult following there, but we learned pretty quickly that market wasn't huge for us. And the real kind of customer that was finding the real benefit to our product was moms with young children. If you've ever had young children, you know that skin issues, cut scrapes, baby skin issues from diaper rash, they're just daily issues. And so we really found our customer to be that mom. And then more specifically, we call her the Whole Foods mom or the granola mom, somebody who really values natural non-toxic solutions and is willing to pay a little bit more for a better product, a cleaner product for themselves and their family. And so, knowing that that Whole Foods mom was our customer, differentiating against Neosporin became really pretty easy to say this is both toxic, it's petroleum based, it uses synthetic antibiotics, all of the things I just talked about. And active skin repair provides a cleaner, more efficacious alternative to that, so you can get all that, efficacy from an antimicrobial standpoint without you having to use synthetic antibiotics and petroleum product. And that really resonated with that mom who's looking for those cleaner solutions. And that market as a whole has just been growing in the clean beauty, better for you wellness category has really exploded over the last 5+ years. So we've been able to understand our customer, and there's just been more customers coming looking for these types of solutions.
So, in terms of that, what channels are you using now? I think we had talked a little bit about Amazon and your website. Are you in Whole Foods? Are you looking at other kinds of retail distribution? Like, how are you distributing the product currently?
What we figured out, one, was specialty retail is a great place to build a brand. It's not a great place to make money. So I think we still have a lot of legacy specialty retail accounts. I think we're in a few hundred stores, but it accounts for less than 1% of our revenue these days. Our business really splits into our either our website or Amazon. When we launched Active Skin Repair, we were probably the first hyperchlorous brand on Amazon, and or if not the first, one of the very first. And it was in 2017 where Amazon still wasn't the beast it is today, and our product reviewed really well. So we saw, I mean, immediate traction on Amazon, one, because of how well it was reviewing, and because, again, I think that market was growing where people were using Amazon to find better for you products. It was around 2020 that we figured out Instagram influencer marketing and using mom influencers, natural, non-toxic influencers to communicate what our brand is, how it works, and all the things that they were using it on for their family. And that really created the flywheel for our direct-to-consumer website business.
Great. So you're now currently doing Amazon as a big player, and I guess let's talk about the Amazon strategy. Let's what are, because the title we have is How to Launch a Successful Consumer Product. Tell us what some tips that you've learned about Amazon that really helps. You just mentioned one, reviews, of course, but what other things do you think are important for marketers and entrepreneurs to think about when it comes to Amazon?
Well, I would say Amazon today is very different than Amazon 8 years ago when we launched. I think you used to just be, I mean, if you launched a brand in 2013, you could just throw the brand up there and it's, was cranking today just because of the time on site and all the reviews that it's generated, assuming it reviews well. Nowadays, I think Amazon we look at as kind of, it's like a rain catcher. It just that's the first place most consumers go to look for products, and where with how we've all come adopted to Prime, it's really taken a pretty substantial chunk of that, even that first aid category, out of pharmacy and onto Amazon. So people know that they can get the product same day or next day. So they're searching for products that they normally would have gone into a CVS and look for. And so we spend a lot of money in those keyword searches. So being able to bid against a Neosporin, right? Somebody's searching a Neosporin and being able to show on Amazon why we're different and why we're better. We are also going after all those generic words, all the cuts and scrapes and rashes and diaper rash and things like that. And then we're doing a lot of off-channel. So we know that podcast, I think the return actionable coupon codes being used through our website, it's a really low ROAS. But when we run the podcast and we're running them through our seasons, we just see that lift in Amazon. So we know running a lot of omni-channel kind of advertising is also going to feed Amazon as well. And then, in terms of launching, reviews are just so critical, and being able to get those first, 100 reviews and be above a 4.5 is just kind of really critical to having that success.
Very good. That makes sense. Tell us about a little bit more about the influencers, and I think you've mentioned you've also done podcasts. Any specific tips there that's been helpful for you as you building your brand and your company?
Yeah. So what's worked for us is Instagram stories. So working with influencers, we use a variety of influencers. Our marketing budget is around $1 million for influencer marketing. So we do quite a bit of robust marketing through influencers. And we're running anywhere from 5 to 15 in a month. The first thing we're looking for is, are they talking to our mom? So we know 95% of our customers these days are females between the ages of 25 to 45, right? So is that their primary demographic? If they skew too young, and they're talking to 18-year-olds, we know that doesn't really convert well. If it goes too old, same thing. The one plus kid is a very important one. And do they have some sort of credibility into the kind of health and wellness space, is really critical. There's a lot of influencers that we use that um, focus their whole kind of influencer communication around better for you products, right? And so those tend to do really well. People educating on, not just skincare, but a lot of these influencers are doing a lot around food and how to feed your family, recipes to cook healthier foods, to eat cleaner and better ingredients. And so those influencers do really well for us. And we build a portfolio of them, and we look at it almost as an investment strategy. We know that one will perform at 2x ROAS and one might perform at a 0.5. And the goal is for us to come out around a 1.5x ROAS is where we usually want to be on our overall spend. And
Got it.
that's looked at attributable coupon codes by the influencers. So they're generally saying swipe up, and that automatically swipes up is going to kick to our website with a coupon code.
Great. And you're using it across both Instagram and TikTok and Facebook, or what are you finding your channels are the ones that are working these days?
Everything has really been Instagram stories for us right now. We are just getting going on TikTok. The TikTok generally in the past has skewed younger, so we've kind of most of our women who are in that age group of 25 to 45, we found to still be on Instagram, and
Makes
that's the
sense.
most effective way. When we've
Yep.
tried TikTok, it just hasn't performed. So Instagram stories is 95% of what we do. We're also looking at more YouTube videos as well, but again, Instagram.
It makes sense. Before I pivot away from the influencers, how are you finding them? Are you using an agency or one of the websites out there? How do you select your influencers? And it sounds like if you're spending $1 million, you've gotten pretty sophisticated. So any tips about that?
We do, and I have somebody internally who that's about 30-40% of her job is
Right?
looking through and running our social media. We're looking at what other brands are doing too and who they're using. And if we think there's a brand that's, in that clean beauty, clean skincare, better for you kind of wellness category, we'll look at people that they're using. We do use agencies as well. So we'll have agencies do recruitment for us. And the one last thing on that is where we really found that success is when we kind of, as a brand, um, we require the influencer to have used the product to really have a good foundation and understanding how they use it and success stories that they'll have with their usage, especially on their family. And so we really like to make sure that they've kind of vetted the product and have that, strong belief in what we're doing as well.
Great. Awesome. Paid social media. Are you doing any with paid? And what has been your experience there?
We have done paid. When we first started, it was really tough to scale. Over the last 2 years, we've been able to scale it. That marketing budget's in that kind of $1 million range for us on paid. So we kind of look at it split there, kind of paid to influencer marketing. Meta is kind of the big driver. I mean, it's about 70% of our spend is through Meta, with another 30% through Google and YouTube, but that's the bulk of it's going into Meta. Our real, I think, ability to scale has just been continuing to, one, grow our funnel of customers and be able to retarget through Meta, and also just running a lot more creative variations and figuring out what's converting.
It's awesome. You even experimented with linear TV. How did that go?
So we're a very seasonal product. So our bulk of our sales are going to run from around May to end of August. So we did run TV through that time period. I think it was, we've generally been very performance marketing oriented. So things that have directly attributable ROAS to it, where, I can know a coupon code used by an influencer and what that return on investment is and what Meta tells me that is. Linear was much more challenging because we just didn't have that. Attribution available like we're used to. We do think it had an overall lift, especially in Amazon, but it was very tough for us to quantify that. So I'd say it's a little bit challenging. We are looking at potentially going into mass retail, if that made sense for our brand. If we do that, I think linear TV would have more of a place in our marketing mix. This year, we've decided we're going to actually go to connected TV. And even though the CPM is quite a bit higher, we think being more targeted will bring more value. And with CTV, we'll also have way more attribution metrics.
Very good. So I'd love any other advice. Now, keep in mind our audience is pretty varied here. We have entrepreneurs, we have healthcare businesses, a whole bunch of different types of people. But for anybody thinking about launching a new product or service in a crowded market, what are some of the things you've learned, like some of the insights you've had? Because that's a master's program by itself, right? It's a specific thing. What have you learned?
Yeah. I mean, I think we were really lucky. First aid, I mean, if we look at, I think we categorize ourselves more as skin health, kind of a more broader usage. But at the core of our use, when we do our post-purchase surveys, 60-70% of our customers, being moms, are using it for first aid purposes, right? Cuts, scrapes, rashes. So that's still the bulk of where our product's being used. That was a really dusty category. I mean, you really hadn't seen any product innovation in there for 70 years. It's Neosporin, Bacitracin, alcohol. And so I always looked at it, yes, it was kind of a dusty category, but I looked at it as a category ripe for disruption. So I always think being able to go into a category with something unique, and hypochlorous acid, I really had that true belief, and I think it's proved out to be a really powerful technology that didn't exist or consumers didn't know existed before. So I think having a really unique product and being able to have that kind of differentiating selling points to it was critical. I think the I think you've always got to be looking to what's next. I think we were able to get on Amazon at the right time. I think we were a little ahead of the curve on influencer marketing. When we started the influencer marketing, unfortunately, it doesn't perform like it does anymore, but it at the very early, when you're in the 2018 to 2022 phase, the return on investment was just mind-blowingly good. And so always looking for those trends where I think you're going to have an outsized return on your money. And being able to kind of, for now, we're looking at how is search going to change with AI, right? And what are we doing in terms of these large language AI models to have our product be relevant as people are searching for these issues? Because I think the old way of just going on Google. So always looking forward to, I think, what technology is doing, what platforms are coming up, and have that potential to be really meaningful in your business. And the last one I think is just thinking outside the box. I don't think when we launched the products, we really focused again in building that kind of cult following within outdoor sports and specialty retail. It was tough to scale, but I think it created a really uniqueness to our brand.
That's great. I think that one of the things you said a moment ago was, and I always like to come back to when I'm consulting with clients or speaking or whatever. I talk a lot of times about just the basic four P's or seven P's, how many P's you want to talk about. Whether it's, seven P's would be price, place, product promotion, packaging, positioning, and people for healthcare. So we talk about those a lot. But the one thing is that most marketers forget about the most important, which is the product. Like, what is your product, right? And see what you had there, you just mentioned as you focused on the product first, you had a unique and uniquely, not just a unique product, but a unique benefit product that in a very tired, sort of crowded market. But that's the key is it's a lot easier to create a wave when you have that. If you're just trying to be better at marketing, it's really hard, especially in a mature marketplace. So I think that was really smart on your part. And I think also I love the innovative strategies back at the time. These were it's like it wasn't just the usual sort of tool set. You explored other things, tested and pivoted. So congratulations to you. I think it's a great job. I think it's a fun success story. Love it.
Thank you.
I have
Yeah,
a
I think you
question.
touched on
Go
one other
ahead.
thing too that I
Sure.
would really think was important for us and being able to really listen to the customer and understand what, you know, how they were using the product and what was most important to them. Coming from marketing to physicians, I thought clinical evidence was the most important. And what we pretty quickly heard was that was actually like number five on the list. The natural non-toxic was number one. And so I think we were really quick to learn and adapt to make sure we were saying what was most important.
I'm so glad you had that insight. It's funny. I have I'm minority interest in another product called Memory Air, which is about based on science, 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 science. And that product is just in the early stages of launching, but that has all this science background. But that's exactly it. Like the consumers, it's nice to know, but it's not usually what's going to drive it. And um, it's if you're from the healthcare culture, it's hard to forget that because you're talking evidence all the time to HCPs and to people in the business. And what's funny is like anecdotes, not even research studies, but anecdotes away just as much. A single testimonial can outperform mounds of clinical studies. And I know it shouldn't be true, but it is. I think that's a great insight. I'm glad you brought that up.
Well,
Because,
and
yeah,
we learned pretty quickly with influencer marketing is I used to get on before and talk to the influencer before they would post and go through the science and really give them a really solid understanding of the clinical evidence, the science, everything around our product. And what we found was those performed worse than the ones where I didn't talk to them. When we just gave the influencer the product and said, do your research, tell us how you're using it with your product, with your family. That kind of authenticity and simplicity of how they knowing their followers and knowing what was going to resonate with them. When we just let them be authentic and simplify it, it works so much better. And so it was kind of a lesson learned.
I love that too. Wow, this is some bonus insights I hadn't expected. So that's terrific. Um, it was great having you today. I'm curious. We certainly some of the people in my audience are in your target audience. I didn't ask you about this before, but if you have a user code, I'm happy to share for signing up on your website.
I will get one for you, Stuart, and you can put it in the show notes, but I will definitely get one for you. Yes.
Great, awesome. Hey, it's been fun talking to you. If you're listening to this and you didn't have it, just go to my website, healthcaresuccess.com, and you can grab it. Or what's your website? You can just go directly for it.
It's activeskinrepair.com.
Perfect. Hey, it's been great having you today. Justin, I appreciate your time. It was awesome.
Thank you, Stuart.